Honourable member from Mermaid-Stratford and the opposition House Leader.
Thank you, Mr. Speaker. Today is Pink Shirt Day. This year's theme, Lift Each Other Up, is about embracing diversity, respect, acceptance, and inclusion for everyone. This is a day that we will see a lot of people speaking out against bullying. I believe it's important to speak out about bullying, but I also think it's important to check our own backyards to ensure that we are not creating environments where bullying can happen. A workplace that is free from bullies thrives, Mr. Speaker. It benefits from low employee absenteeism and low turnover rates, not to mention a positive and fulfilling workplace for everyone. Does that sound like your government departments? Ministers, do you have a workplace free from bullying? Are your staff happy? What does your department's absenteeism look like? What is the turnover rate? Do you lead a workplace that embraces diversity, respects all staff, and includes everyone? Have you personally talked to your frontline staff, employees to find out if they are happy in their workplaces? Mr. Speaker, the quality of leadership in an organization can contribute to a bullying culture. According to the American Medical Association, bullying is prevalent in healthcare. Poor staffing levels, excessive workloads, subpar management skills, stress, and a lack of autonomy are some of the factors that contribute to workplace bullying. That sounds like the environment that our healthcare workers are experiencing right here in PEI. The person who has full authority to change these conditions is the Minister of Health himself. Mr. Speaker, do healthcare workers on PEI face bullying in the workplace? Bullying in healthcare is so well documented, and no one should be surprised if the minister answered yes. Some do. I expect the answer to be yes, because I have spoken to current employees and some that have retired, workers that are out on stress leave and are terrified to go back because of the working conditions that they were in. I've spoken to people that have transferred out of their units, transferred out of their department, and exited the profession completely for exactly that reason. So what do we do about it? The first step is acknowledging bullying in the workplace. The first step is to addressing bullying in the workplace is to first acknowledge that it exists. Then addressing that problem requires total commitment at every point in the healthcare ecosystem, from the individual level to the organizational, including policy and advocacy for prevention. But if the minister does not admit that there's a problem, then we have no chance to address the issue. Thank you, Mr. Speaker.